Good evening, everyone, and thank you for joining our latest Facebook Live Q&A. For those of you that haven't seen one of these before, I'm Councillor Carol Runciman. I'm Executive Member for Health and Adult Social Care, and I'm Chair of the City's Health and Wellbeing Board. This evening, we'll be discussing and answering your questions regarding the latest changes to national guidelines and everything public health related. I'll shortly ask the panel to introduce themselves, and then we will begin with the questions. This week, I'm very pleased to be joined by colleagues from Nimbuscare, Indy York and York Bid, as well as Sharon Stoltz, the Director of Public Health at City of York Council. We look forward to discussing what you ask, so if you haven't already asked a question, please post them in the comments. Before I go on and ask our panelists to introduce themselves, I'd just like to touch on a number of key issues from the past week. As announced by the Prime Minister earlier this week, on the 19th of July, the country will proceed to step 4 on the government's roadmap out of lockdown, which will see a further relaxation in national restrictions. While this is undoubtedly a positive step, it's important to recognise that the pandemic is not yet over. There are many people who will be anxious about this move, and there's no doubt that this will bring changes for us all. With this in mind, we would like to encourage everyone to continue to think of others whilst enjoying yourselves and supporting our fantastic local businesses. As many people will know from both the national and regional media, coronavirus is still here, and cases in the city are at higher levels than we would like. Many people are still yet to get the protection of 2 doses of the vaccine, so I'd urge everyone to get tested regularly and do what they can to help reduce the spread of the virus and take a vaccine when you're offered it. On a more positive note, over the past year and a half, residents, business, key workers, volunteers, and communities have been amazing in their response to the pandemic, doing everything they can to keep our city safe. That's why I'm confident that York is well placed to build back better from the crisis in the months and years ahead. As ever, our support line remains open for anyone who needs support. So if you want to ring us, it's 551 550, or you can email us on covid19help@york.gov.uk. Now I'll ask our panel members to introduce themselves, starting with Andrew Lowson.
Thank you, Councillor. Yeah, my name is Andrew Lowson. I'm the Exec Director of the York Bid, York Business Improvement District, and we represent about 1,000 businesses inside the city centre.
Mike Holmes.
Yeah, thanks, Councillor. I'm Mike Holmes. I'm a GP at Haxby Group in the city, and I'm also the chair of Nimbuscare.
And Rebecca Hill.
Hi, thank you. My name's Rebecca Hill. I'm the chair of Indy York. We've got about 220 independent businesses in York, and I've got my own business.
And Sharon Stoltz.
Hello, everyone. I'm Sharon Stoltz, Director of Public Health.
Thanks very much, everyone. So I'm going to pass over to Sharon to provide a bit of an update on the latest data and information. But please do post your questions in the comments section, and we will pick out questions as we're going along. Thank you. Thank you, Sharon.
Thank you, Councillor Runciman. I'm not going to really talk about a lot of data and figures here. I'll share some information on the latest position, but for those of you that are interested in looking at the detail of the figures, you can find that information on the Council's open data platform. For those of you that are interested in digging into the detail of the numbers, I would suggest that you access that data on our website. So in terms of where we are today, we've had 862 new cases of COVID over the past 7 days. That's our provisional data, our local data. The national validated data that's been published today says that we have 871 cases. So what that appears to show, those of you that have been following the case numbers closely, is that the peak of cases that we've seen over the last few weeks appears to be starting to tail off. I say appears to be because the data doesn't necessarily follow a straightforward trend. And if we have a large outbreak, then obviously that can conflate the figures for that particular week. But the good news is that the rise in case rates appears to be slowing slightly. So hopefully that trend will continue. We are seeing infection across all age groups, but the bulk of the positive cases that we're seeing is in the younger age groups. So we're really talking about school-age children and young adults, particularly adults between 18 and 25 years. And that's where we're still seeing the largest number of infections. We know that that is linked to vaccination. Obviously, children are not eligible for the vaccination program. And as Mike Holmes will explain later in the session, younger adults have only recently become eligible for vaccination. And so there are larger numbers of young adults that are not protected by the vaccine at the moment. And the Delta variant of the vaccine virus that we're seeing currently is very successful at searching out and finding the individuals living in our communities that are not vaccinated. So that's why we're seeing higher numbers in that age group. It's great news, isn't it, that the government is lifting legal restrictions on the 19th of July with changes to the self-isolation guidance also expected before the 16th of August. However, the pandemic is still with us, as is shown by our numbers. 862 new cases of COVID in the last 7 days means that we still need to be cautious. Even if you're double vaccinated, it's still important that you continue to be cautious. We know that vaccination has helped to weaken the link between serious disease and needing to be admitted to hospital, and has significantly reduced the risk of someone dying if they get COVID. We still are seeing hospital admissions slowly increase, and we fully expect there to be more deaths from COVID as we go through the exit of the roadmap. So as we go through the session this evening, we'll be talking in more detail about how we can enjoy ourselves with the restrictions being lifted, seeing life getting back to normality again, but also the simple steps that we all need to take to keep ourselves and our family and friends safe.
Yes, thank you. Jasmine has just asked us about the hospitalizations as cases are rising. And of course, it is different from what we saw before, isn't it, Sharon? We're not seeing quite so many serious cases in hospital, is that right?
Yes, that is right. So earlier in the pandemic, we saw a peak in hospital admissions last spring when at the start of the pandemic, we saw a big spike in the numbers of hospital admissions around about Christmas time, January time. But this time, what we're seeing is a gradual increase in the number of patients in hospitals. So our latest data, for example, shows that there are 15 patients who have COVID in general and acute beds in York Hospital at the moment, and 2 in intensive care. So that number has gone up, but it's going up slowly. And I'm not expecting us to see the significant rise in COVID admissions to hospital that we've seen previously. And that's really because of the success of our vaccination program. But undoubtedly, we will continue to see some COVID admissions, but nowhere near the numbers that we've seen previously.
Thank you, Sharon. Now, I've got a question from Amy I'm going to cover, and I'm going to bring Mike in after it. She's asking about schools closing because she's got a child and she says there's only 1 week to go. And I can say that each school has to make its own decision. It isn't within the council's powers to say that a school will close or won't close, particularly an academy. They always take public health advice, and there are people in Sharon's team who will always go and give them advice. But what I want Mike to talk about for us is, why can't children get vaccinated? Why is it only the over 18s? And do you think it'll change?
Thanks, Councillor Runciman. Well, I think that in the beginning of the vaccine programme, there were a couple of reasons why children weren't vaccinated. One was because we were focusing on those in our society who were most at risk. So this committee called the Joint Committee on Vaccinations and Immunisations set out the cohorts that were to be vaccinated based on risk of serious illness and death, which is why we focused on our elderly population, care home populations, and health and social care workers. But the other reason is that the vaccines were tested on adults, and we didn't have the data available around the safety of vaccines in children. So what we saw was, I think the Pfizer vaccine was licensed for 16 and over, and the other vaccines have been licensed for 18-year-olds and over. We're starting to see that relax a little bit, and in some countries they are now vaccinating teenagers. So at the moment there's no guidance for us to vaccinate children under 18s. It may well be that that changes in the future, but right now I'm not hearing any plans that they will be involved in the vaccination program in the near future.
Yes, thank you, Mike. So, Amy, I think the answer is it is the school's decision whether they close early or not. It's not the local authority's decision. And obviously, if he's having to isolate now and he's only got a week left, you may need to talk to the school about what's best to do. Now, I'm going to change a little bit and say, Andrew, if people come back into the city centre after the 19th and haven't been in the city centre for some time, what are they going to see that's different?
Well, they'll still see plenty of shops there selling fantastic goods. So that's the main thing to mention. I think we're obviously conscious about the changes that are coming, but I think in the business meetings that we've had and speaking with partners, we've agreed that it's quite important to keep the strong messaging there about hands, face, space, because I think even though rules are changing, that people are still wary of these things, and we want to make sure that people are confident that if they come into town or other parts of York where there's businesses, that they can enjoy their shopping experience or their hospitality they might be going to, feeling safe and comfortable. So, I mean, I suppose, just to mention, yes, that we still have, for example, lots of signage around the city centre, just, asking people to still show, respect and distance, where it's applicable. We still have our hand sanitizer stations. There's street rangers, COVID marshals who are there to give friendly advice if needs be. So I think, for those people who might have come, last summer when things have opened up again, you'll probably, feel very similar to that. And I suppose and Rebecca might come in here as well, but I'd like to say businesses are very much still keeping they've all done their risk assessments, they're all making their own individual assessments, I suppose, in terms of what's right for their customers, but also businesses are very conscious about what's right for their staff. Because they want to make sure the staff well-being is there first and foremost. They obviously don't want to be losing their staff to any COVID cases. So I suppose what I'm saying is, if you come in, you'll find that it is business as usual. There's lots of procedures in place to make people feel safe and welcome, and we're hoping for a good summer trading across the city.
Yeah, I think that's great. But what I will say is, when I went into the city centre, I loved the seats. I thought the brightly coloured tables and chairs and benches were really, really good and very welcoming. So, Rebecca, what would you like to say about the independent businesses and having people back in the shops?
Yes. Well, I think the independent businesses have actually fared reasonably well. I've said a few times that if they've made it this far, they're sort of on the home straight now. And now, luckily, they seem to be reaping the benefits of what has been quite a busy time in the city. And I think that what the pandemic has done is had a bit of a resurgence of love for independent businesses, which we seem to be seeing the results of now, which is very nice. Not just in customer numbers, obviously that's great, and that goes through to the bottom line, so we all appreciate that. But it's things that don't cost money as well. It's just the goodwill and the good feeling and the nice posts on social media or Facebook. It's everything, really. There's a nice feel in the city at the minute, and I do think that the independent businesses, have a lot to do with that. 65% of the businesses in the city are independently owned, and they have worked very hard through the pandemic. So I think that makes York quite special and unique.
Yes, I think it does. And our little independent business are really what makes York City Centre, aren't they? And of course, they're out in the suburbs as well. They're in our secondary shopping centres in Haxby and in Acomb. And I know they will welcome customers back, and will be very careful when they do it.
Absolutely.
So another question now, Mike, if people have turned down the vaccine before, and there has been a lot of social media stuff saying that it doesn't work or whatever, can they still have it? And if they haven't got an NHS number, can they still have it? I wonder if you could talk about that.
Yeah, so we understand there's lots of reasons why people may not have been ready to have the vaccine at the time they were invited to come and have it. And I think we've tried to say all along that if you do turn it down, it's just at that point. It's not forever. So we're very happy to vaccinate people. We, as you know, we're operating walk-in clinics now. So the service at Askenbar is walk-in, no appointment is required, and the pop-up clinics that we're operating around the city are also walk-in. So absolutely, if someone has declined it in the past and would now like to have a vaccine, then they're more than welcome. We'd be more than happy to vaccinate them, because we think that's the right thing to do in the circumstances. And if you don't have an NHS number, that's not a problem either. We're able to vaccinate you, and then we can worry about that side of things afterwards. The most important thing is we protect the individual. So neither of those things are a barrier to getting your vaccine.
That's great. Andrew, I'm coming back to you. We've been asked particularly about the pubs, whether you have to book into the pubs or whether you can just go, and whether you have to sit outside, and that would apply to the restaurants too. Can you answer that one?
Good at answering questions on pubs, Councillor, so happy to take that. Yes.
Good for you.
I think, yeah, I saw the question in the chat from Chloe. So, I mean, in terms of, I think Chloe's asked, yeah, will pubs still be operating a booking system? I think it will be down to the individual, pub or restaurant or cafe. I suppose what I would say is, I think because you've heard a lot about the problems that hospitality are having in terms of recruiting staff, the app which is pinging a lot, which has been isolation. So I suppose the reason I mention that is it is difficult for hospitality in particular to plan at the moment. So if you can give someone advance notice, if you think about going to a restaurant in a couple of days' time, just ring ahead, book. It makes life a lot easier for them because it helps them with staffing. That's not to say there won't be plenty of places you can drop into, but I think it's those little things that can make a difference.
Lovely. And Rebecca, are you concerned about an influx of tourists? And what would you recommend for businesses, particularly if they have a COVID spike? I must say, I went to our bank the other day, and to my astonishment, it was closed because of COVID. And I know it isn't a small independent business, but that must happen in other places.
Yeah, that like Andrew said a second ago, that's such a big topic at the minute. Is one, in the industry, there's staff shortages anyway for a whole variety of different reasons. But then the staff that we do have are sometimes getting pinged by the app and being asked to isolate. And that's quite poignant in smaller businesses, because sometimes you only need 1 or 2 people to open and operate. So if just one person goes off, that could have quite a big effect on the entire business. So that's the worry, and it's a big topic that I'm certainly hearing, obviously with a hospitality hat on, all the time at the minute. With regards to the other question about the amount of tourists, we've actually had quite a busy time for the past few weeks. I don't know the exact numbers, Andrew probably does, but from a hotel's perspective, you know, we've only got 12 rooms, we're very small, but we've been fully booked every night. Now, historically, we'd always be fully booked on Fridays and Saturdays, but in the week we would normally have 1 or 2 rooms available, and we don't at the moment. We obviously rate shop our prices against other hotels in the area, and you can see that there's very few rooms available, and those that are available are obviously at a higher price because there's so much demand in the area. But, you know, I think that's good. I think York is a sociable city, and you know, tourism has an awful lot of benefits, you know, because it's a tourist city. There are amazing restaurants and amazing places to stay, and, you know, there's a bid who do, you know, seating and activities and all the amazing things that make York what it is. So I think that's a good thing. I think everyone needs to be respectful, like somebody said earlier. I think a lot of businesses have invested quite a lot of money in their COVID precautions. So I don't think that they're going to disappear on Monday. You know, if people have spent a lot of money on screens or signage, there's no reason to rip that all out. So I think that York will continue to be as safe as it can be, personally.
Yes, that's good. Yes, Sharon, do come in.
Yes, just to add to what Rebecca has been saying, I've been having a number of conversations with businesses, and the majority of businesses are absolutely following what Rebecca's just said. You know, we want York to be a safe place for people to for visitors to come in. We want our staff in our businesses to feel safe to work. And so despite the legal requirement for mask wearing, etc., that will disappear next week, there is a desire to still have those COVID safe measures in place. And certainly the message that I would give to people, you know, living in, working in and visiting York is, just because there is no legal requirement, it doesn't mean that it's not the right thing to do. Right. And that, you know, keeping your distance from people that you don't meet on a regular basis, you know, ensuring indoor places are well ventilated, meeting outside when you can, you know, hand washing, hand sanitizing, and actually wearing face coverings are sensible things to do. Whether you're vaccinated or not, those are sensible things to do. And, you know, the message really is to carry on doing them, because that's the only way we're really going to keep the number of infections down.
And the number of hospital admissions.
Exactly. And I think what we've heard from Andrew and from Rebecca, and some of the questions coming through on the chat, is whereas in the past, the seriousness of COVID has perhaps been measured against the number of hospital admissions or the number of deaths, those are coming down. But the impact of the pandemic is still being felt across wider society. In fact, probably more now than in earlier stages of the pandemic. So we're seeing more businesses struggling with staff off sick, either because they've tested positive or they're having to self-isolate. We've seen a greater impact on schools. We've never had the number of COVID cases in schools previously that we have now. And, you know, we've got a situation where our green bins can't be collected because we have a shortage of HGV drivers. You know, shops are beginning to be concerned about their ability to keep their businesses open. So people really need to understand that if we want our society to function as we want it to, and to get life back to normal, we have to follow these COVID measures. Otherwise, we could find ourselves in a really difficult situation and potentially another lockdown as we head into winter.
Thank you. Andrew, you wanted to comment?
Yeah, it's just picking up a little bit on what Sharon's mentioned there. And then I've also seen that Jason's asked a question just about, you know, he's mentioned that there was a bit of a vague post from First Buses about mask wearing. But I suppose I was just going to highlight the point that, I mean, I didn't see that post, but I can understand why it maybe come across a bit vague, because this is the problem that some businesses have. I think we've seen quite a lot of transport companies say it would have been better if there'd actually been quite, you know, black and white rules on mask wearing on transport, because therefore then it is a black and white issue for people, both the business and also the customer, where even if First Buses wanted to bring in people to wear masks on buses, they can't legally enforce that, and it puts the driver in a very difficult situation if someone chooses not to, or, you know, there's a reason they don't want to. So I think that's just, you know, to what Sharon says. I mean, I do know there'll be certain businesses in town, because they've asked me about this. They will maybe put a polite sign on their door saying, we would prefer you to wear a mask. And I mean, all I would say to people listening, and I'll say this, is, you know, please, if you can do, please respect that, because it's no different from, you know, if you went round to your neighbours and if they asked you something, you know, there's everybody's got still concerns. I think that's why I think that I think it was Rebecca early on used the term respect. So let's just keep respecting each other, you know, viewing, you know, understanding what that person's view is. And I think if we do that, you know, we can still go out, we can still enjoy, you know, businesses, outdoor space and socializing. But it's I think what we're all agreeing is, just because we've come to this date of the 19th, I just don't think it's all back to how it was 2 years ago.
No. Mike, I'll come to you, and then I've got some questions for you about vaccination.
Yeah, thanks, Carol. I just wanted to follow up on that theme, actually, and just share with people the words of the Chief Medical Officer. Actually, you know, when the Prime Minister announced this, Chris Whitty was very clear in what he thought, and he talked about wearing your mask or your face covering in crowded spaces, particularly indoors, but also outdoors. And I think for me, a bus or a tube or whatever counts as a crowded space. And I think we should still do that. He talked about wearing it when authority said so. And I think we're going to see in certain areas, particularly in my industry and healthcare, you know, I think for our practices, we're going to say that nothing changes. We still wear masks, doctors and patients, please, you know, when you come into healthcare premises. And I think that feels like the right thing to do. And the third thing he says was, do it when other people ask you to. And I think that comes back to a theme that we're hearing from all of our speakers about respect and consideration. If someone feels uncomfortable, please put your mask on, because your mask is not, it's a little bit about protecting you, but it's more about protecting other people. And I think that's really important.
Good. Right, there's a little series of questions now. One's about flu jabs. When will we get them, and will they come together with COVID jabs? When will people get their boosters? And really, Leanne's asking, do you think that children will be vaccinated as schools are struggling because more people are isolating? So I wonder if you could take those.
Yes. Okay. So let's talk about boosters in the autumn vaccine program. So that is being discussed now, and I think details will be announced about that very, very shortly. My understanding at the moment is that I don't think the vaccines will be co-administered, so they won't be given at the same time. There'll be a flu and a COVID vaccine. Some of that is to do with the clinical safety of that hasn't been properly signed off yet and may not come until later in the year. So it won't be ready for the beginning of the autumn vaccine program. And some of it is to do with supply. You know, we've talked about supply all along, and to coordinate 2 vaccines at the same time is going to be very difficult, I think. So flu will come probably starting, September as normal. I'm sure our general practices will be involved in delivering that to begin with. In fact, I've been discussing that with them this afternoon. So we're still working out some of the details. My hope is that the COVID booster program will be delivered mainly from Askenbar again, with pop-ups around the city as required. And then there will be flu for 50 to 65-year-olds again this year, and that will probably come later in the season. So the booster program will be for 50 years and older. And it'll be also for those people who are at risk, particularly at risk from long-term conditions or because they work in health and social care. And in terms of the drive-through flu thing, I hope we will have a service for flu particularly for the 50 to 65-year-olds at Askenbar. It probably won't be drive-through as it was last year, but it'll be drive-in in a similar way than we're putting on for COVID vaccines at Askenbar. And in terms of children, I think that's a really difficult question because there's emotive arguments on both sides of this particular coin. And I think as far as I'm concerned, obviously we want to protect our population. We want to do the right thing for the population. We don't want to be putting anybody at risk. As a doctor, my prime directive is to do no harm. And we don't want to be doing anything to children that potentially puts them at risk. So as the data comes through, as the evidence comes through, as the vaccines are licensed for use in children, then I'm sure a program will emerge for them.
Yeah, that's lovely. Thank you. And Sharon, just to satisfy Chloe, the COVID wards aren't open again at the moment, are they?
So So the hospital naturally will have a system of separating COVID positive patients to other non-COVID patients, and that's routine. So they will be cohorting those patients onto so-called COVID wards. But the hospital isn't at the stage they were earlier in the year, where they were having to open additional COVID wards, if that's what you're thinking about, Chloe. So it's kind of business as usual within the hospital at the moment. And obviously we hope that it's going to stay that way. The biggest pressure, or one of the biggest pressures that the hospital has at the moment, not just in York, but the whole of the health system, is how busy it is with non-COVID work. Yeah. So there are large numbers of staff across the whole of the health service, including in primary care, community services, as well as hospital services and in mental health trusts, of staff having to either to self-isolate, either because they have tested positive for COVID. So even if you're fully vaccinated, there is still a chance of getting COVID, or more likely they are contacts of a positive case, or they're having to stay home to look after children whose bubble has been sent home from school. So that's having a really big impact on the health service at the moment. And then the NHS is also trying to catch up on the backlog of routine treatments, routine surgery, that was halted while the NHS was very busy looking after COVID patients. So there's a program of trying to catch up with those elective treatments. And we're also seeing an increase, as I'm sure Mike will be able to comment on from a GP perspective. COVID has suppressed a number of the respiratory viruses that we are all exposed to, because we've been wearing masks. We've been, in lockdown or socially isolating over the past, 16 months or so. Our natural immunity to some of the respiratory viruses that are around all of the time are also impacting on people, particularly in children. So the hospital, particularly the A&E department, is seeing large numbers of people presenting with other non-COVID conditions that is putting pressure on the NHS as well.
Thank you. Now I've got a question which I'll ask Rebecca to answer and then Andrew, and that is, how do we encourage people to come to visit the businesses, either in the town or independent business? How can we reassure them that all is well and they can come?
Oh, I don't know. That's a big question. I mean, everything's moved online so much over the past,
Yes.
year and a bit. So I think communication has never been better. From an Indie York perspective, obviously we couldn't do a lot of the activity that we would normally do because we used to do a lot of events. Obviously we are predominantly a paper map that used to get handed out, all of these things that couldn't really happen as much as we would have liked previously. So we, like everybody, has shifted a lot of our efforts online. Certainly social media is amazing for us. We've got 10,000 followers on Instagram. So from a communication point of view, that's been, brilliant. And most of our businesses have done the same, even if they haven't set up online shops, they're just communicating online. So I suppose if anyone has any anxiety about going to a business, especially an independent business, generally there's an owner like myself at the end of, a Facebook message. So if you've got any questions to say, what do I need to do? I'm anxious about coming to see you, can you help? That's the beauty of an independent, is that somebody can write back and say, yes, I'll meet you outside, or just come in, it's completely fine. There's only 3 people allowed in our shop, or, we've got an app for this, or we've got queues for that. And I think that's what it's all about, really. It's just communication both ways. And I think that businesses have got really good at that over the past pandemic time that we've had. So that's been one positive to come out of it.
Good, thank you. Andrew, would you like to comment?
Yeah, I mean, I suppose, sometimes it's good to state the obvious, isn't it, in terms of, why support local? Well, those people who work in local businesses, are often your neighbours, your friends, your family. It helps keep them in jobs. Businesses, obviously, if they do well, they stay open. They pay their business rates, and that gets invested back into local services. So I think sometimes, because there's so much, we hear about shop local, support local, but sometimes it's just good to state the obvious as to why we say that. It's all about, supporting your local economy and jobs, and that is obviously crucial at this time. I think, coming back to what you mentioned, Councillor, at the start, one reason why I think York is, we get a lot of feedback as to why people are enjoying coming in, and a lot of that outside seating is still in place. And so I think, if you're maybe not comfortable going and enjoying some food or a coffee inside the business, then there's plenty of opportunity to sit outside. We've created little pop-up spaces around College Green, Exhibition Square, Duncan Place. Those are seats that, as you said, the bid with the City Council have put out. But then the businesses themselves also, the alfresco dining, which when the weather's like this is a lot nicer. A lot of the businesses have done that. I think there was over 100 cafe licenses that businesses got, so they can put tables and chairs out. So again, it gives customer choice. And I suppose as the final thing I'd say, and again, I know I'm probably talking a lot about the food and drink here, but going back to what Rebecca had said earlier, businesses have invested not just hundreds of pounds, thousands of pounds, even more, on actually making their venues COVID secure, going back to as we came out of lockdowns. And so you will still go in and you'll see that some of them, and again, this will be post 19th of July, some of them will have kept those plastic screens in place. They will have kept tables spaced apart. You'll go in, you'll sanitize your hands. They may even ask you to wear a mask as you go towards your table. So I suppose what I'm saying is, these things aren't just disappearing, because again, it's important for businesses that their customers feel safe and welcome. So I think, you know, I'm slightly biased, obviously, with York, but I think we've done this as good as any other city. And coming back to, again, what Rebecca was saying here on the stats, you know, the stats are bearing that out, because, you know, our footfall is, you know, maybe around about 15% down on what it was maybe 2 years ago. But if you look at, you know, colleagues in Leeds were telling me the other day, their footfall is still 25% down. You know, a lot of the other cities that. So I suppose we're outperforming a lot of other cities. And I think, you know, our business community, council and other partners need to take a lot of credit for that, with the hard work that we've done to try and make, you know, the city and, you know, the periphery areas around York feel safe.
Great. Mike, I've got a question for you now. This is about long COVID, which we haven't touched on. Hillary is very bothered about children getting long COVID, and she wonders if we should be taking a bit more care of them. I wonder if you can talk about long COVID in general, related to adults and children, and explain a bit.
Yeah, so long COVID is a phenomenon that we're seeing in people who have been infected with COVID, and it's really the development of symptoms, whether that's fatigue or headache, or general lethargy, and there's a whole raft of different symptoms that people are reporting, and we're seeing it indiscriminately. It doesn't really seem to affect any particular age range, and it seems to last between 4 and maybe up to 12 weeks usually, but we are seeing a section of patients that are reporting symptoms lasting even longer than that, sort of post-COVID-19 syndrome, as that's been called. So it's something we're taking incredibly seriously. There's a new service that's been developed in general practice where we are caring for these patients, making sure we rule out other causes, because of course some of those symptoms are what we call really non-specific. A number of diseases or illnesses could be causing them. So there's an important piece of care that needs to be taken place where we rule out other conditions, serious conditions that could cause those symptoms. So there's something about definitively diagnosing it, definitively knowing who has it, and then signposting them to appropriate care. And there's various online services developing that can support these patients, and then we're also developing local services with York Trust to look at what additional support might be needed for them. So something a really important condition that we really must think of. In children, I think we're not seeing much of it yet, but of course it'll be interesting from a medical perspective and worrying from a public perspective to see what happens after this spike. You know, we're seeing our younger cohorts contracting COVID, and we'll need to just watch what happens to see if there's significant numbers of people reporting long COVID symptoms.
I think the thing is, Mike, that we've now recognised it's a thing. And at one time, I think people weren't too sure, but they certainly are now, aren't they?
Yes, I think so, and I think it's good to see that that's been recognised by NHS England, and that there's resources now coming into the system to put services in place to care for these people.
Yeah, thank you. I've got a question from Joanne Sharon. Advice for people who are extremely clinically vulnerable and want to use public transport or want to eat out. What would you say to them?
So it's a very good question, Joanne, and
Yes.
I'm already having a number of concerned residents contacting me about this. The government has published some guidance, came out yesterday, I think, to people who have been shielding. Basically, that says that there are no special rules for anybody who is classed as clinically extremely vulnerable or who may have been shielded. It just says that those individuals might need to be more cautious. Not that helpful, really, if we're being honest about it. How I interpret that is that, you know, there are no legal requirements in place, and no additional protections for people who have been shielding, but that everything that we've talked about with those, you know, basic measures to help keep yourself safe from COVID. So that would mean thinking about how many people you're coming into contact with, You know, making sure you carry hand sanitizer with you at all times. You'll want to be wearing a face mask or a face covering. You know, you'll want to seriously consider being vaccinated if you haven't already been vaccinated, and to think before you leave the house really how you can take those steps to be able to protect yourself from infection. And going back to what we were saying earlier about, you know, people in York respecting and being kind to each other, it's not unreasonable for you to be asking others to wear a mask when they're in your company, so that you feel more comfortable. I'll say one thing about the workforce, Councillor Runciman, if I may. Even though there is now no legal protection for staff to work from home, you know, those working from home guidance has been lifted, your employer still has a duty of care under the Health and Safety Act to ensure that staff are protected in the workforce. So if you're concerned about returning to work, I would certainly encourage you to have that an early conversation with your employer about whether it's possible for you to continue to work from home, or if you're going to have to go into the workplace, to ask your employer what measures they are intending to put in place in the workforce, so that you feel comfortable and safe to be able to return to work. And that guidance hasn't really changed.
Yes, thank you, Sharon, for bringing that up. That's good. Andrew, next. I've been getting news flashes, Andrew, while we've been on this call, which say you can't go here, you can't go there, you can't go anywhere else. So I'm going to ask you, and then Rebecca, what advice would you give to people who want to take holidays this year?
So this is in regard of holidays, abroad, I take it.
Well, yes. Would you say they should stay here?
Absolutely.
I thought you might.
In the nature of my job, I'm going to say that, aren't I? Yes, I suppose that wider question of, I think we know it's going to be a bit of a roller coaster, don't we, with advice on traveling abroad. I mean, you know, I will just say, you know, that there are a few businesses in York that obviously are suffering because of that, because, you know, we have travel agents, we have people who work in the holiday industry, and I have to confess I do worry a little bit, because there's only so long they can go without, you know, if they're not able to send people abroad. But I think, you know, coming back to your wider point, I think you know, York will benefit. I mean, it already has been. I mean, the most recent half term we had, the spring half term, you know, we did very well. You know, hotels, you know, restaurants, retail, because, you know, people came to York, and not even, you know, coming and staying for a week. There was a lot of evidence of day trips, and I think that will continue. I suspect, you know, going back to the fact that actually some people are finding it hard to get accommodation, I think we'll see a lot of day trips of, you know, people coming from the northeast, as, you know, York's a popular destination, from the northwest, you know, the Humber area. This is what we kind of call our kind of day trip catchment area, and I think that is a trend that we expect to see, you know, throughout the summer, and pushing on throughout the year. So yes, I mean, as you know, York, as expect, is if you do have to take a staycation, it's a great place to stay. And I think just picking up on the previous thing when we were talking about, you know, Joanne was talking about the extremely vulnerable. I suppose just two little points on that. Joanne, I'd say that actually there's a lot of restaurants in town who didn't do takeaway offers that are now doing it, so you can still support local if you don't feel comfortable going out. I mean, there's some of the really high-end restaurants who never dabbled with takeaways are now doing that, so that could be an option for you. But also, you know, a lot of restaurants in town have actually, you know, they've created those outdoor areas, as I mentioned, and a lot of them with covered space. I could do a shameless plug for Rebecca's restaurant at the Forest. I chose that myself because, you know, she had some cover there in case it rained, but, you know, myself and my wife felt comfortable eating outdoors there. So do your research, and then you'll be able to see that a lot of restaurants have actually created those little areas where you can enjoy a meal in the outdoor space.
So, Rebecca, do you think there'll be enough hotels, beds available, enough restaurants open, enough attractions open, so that if people want a staycation in York, it'll be a good one?
I do think so. Yeah, I would. I mean, just to balance that out, I would certainly advise booking. I know somebody asked earlier about whether pubs would require bookings, and that will be down to the individual venue. But whether or not their policy is to only take bookings, I would definitely recommend it, because from what we've heard, everywhere's getting quite booked up quite in advance. I think if you can be quite flexible, I think you'll get a really great staycation in York. I think if you're wanting to book, you know, now for this weekend, you might struggle a little bit, but I think if you can come in the week, or if you can give a little bit more notice and, you know, be a bit more flexible with timings and, you know, just organize yourself a little breakaway, I think you could have a great time. The trouble is I think people haven't quite realized that you do need to be that little bit organized. So we've had guests staying, and the majority of them have booked where they're going to eat. They've booked all of their attractions, and that's great. You do get the odd one who will just arrive and be a little bit disappointed that, you know, they hadn't pre-booked. I can't think of an example of an attraction, but they'd not pre-booked to go to the Orvic Centre, for example, and it was already full. So yeah, you have to be a little bit organised, I think. But even if you don't get into the attractions, there's so much to do in York without going inside anywhere. You know, you can have a great time.
Yeah. Great. Walk on the walls for a start.
Exactly. Yeah.
So Sharon, how will people know if they have to self-isolate? Is the NHS app still going to be up and running?
So there's quite a lot of confusion about the NHS COVID app. If you're pinged by the NHS COVID app, it does not, that you're not legally required to isolate if you're pinged by the NHS COVID app. What it does, because it works on Bluetooth technology, so your phone may have been in close contact with another phone whose owner has tested positive for COVID. But we've had situations where, for example, the phones have been locked in lockers that are next to each other. And you know, they've been pinged because the phones have been close together. But because of that technology, all that technology knows is that your phone was close to somebody else's phone who was tested positive for COVID. It doesn't know whether you were socially distancing. It doesn't know whether you were wearing a mask. It doesn't know whether there was a plastic screen between you and the next person. And so the app can't do a risk assessment of somebody's risk of infection. And so the advice that we're now giving to people is, if you are pinged by the app, think back to where you have been and do your own risk assessment as to whether you could have been exposed to somebody who was COVID positive. If you're absolutely sure that you have not been in a situation where you've been exposed to infection, based on your own risk assessment, then you may well want to do a COVID test, but you're not legally required to self-isolate under those circumstances. Where you are legally required to self-isolate is if you're contacted by NHS Test and Trace. And I would include in that our local council contact tracing service that works in partnership with the NHS. So if you're contacted and somebody speaks to you from NHS Test and Trace and you're told that you're a contact of a positive case and you have to self-isolate, you are legally required to self-isolate still on that basis. But with the NHS COVID app, you need to be sensible and do that risk assessment. And if you're not sure about whether you could be a contact or not, you can always contact the public health team on our inquiries.publichealth@york.gov.uk email.
That's lovely. Thank you. And I think this may be the last question, Mike, and it's for you. So how is the vaccine programme going? Have we got most people done in all cohorts? Have they got the second vaccine? How is it all going?
Yeah, thanks, Councillor Runciman. Yeah, I mean, I think it's going well. I think we've now vaccinated 83.6% of all eligible adults in the City of York once, and we're at almost 60% of second vaccines. So that's phenomenal performance. If we look at cohorts 1 to 9, we're in excess of 90% in all of those cohorts in the city. So I think it is going well. We're still not there yet, though. We still have to keep going. And what we're seeing is that there are some pockets of the city where the take up is nowhere near those numbers, and I think that's important for lots of reasons. Sometimes it's to do with the demographic, because those populations there's more younger people in those populations, so they've only recently become eligible, and so we're working through those cohorts. We're putting on extra pop-up clinics in those areas, and hopefully we're seeing an increase. You know, just to give one example of one of the areas that we put additional pop-up clinics, we saw in the last 3 weeks, we've seen a 50% increase in uptake because of the pop-up clinics, which is really pleasing. It's partly that, partly because the younger people are now eligible.
Yeah, that's good. I wondered about the areas where the take-up was low, and it's good to know something's being done about it. Now, I haven't had any more questions, so as we're nearly at the end of the session, I'd just like to thank everybody who's sent in questions. That's really helpful. And you can go on sending in questions or ringing us on 551 550, or as Sharon said, if they're public health questions, publichealth@york.gov.uk. You can send questions to the COVID-19 line and we will do our very best to answer them. But we wouldn't have been able to do it without the public's questions. So we're very grateful to you all. So I'd like to thank Rebecca and Andrew and Mike and Sharon for spending their time this evening to unravel some of the mysteries of what's happening next. And all I can say to finish is, don't forget hands, face, space, and fresh air, because those are the key to staying safe. Thank you, everyone.